Good day, everyone, from the Multiple Choice Mothers of Multiples Club. I just wanted to introduce myself. My name is Dr. Todd Cohan. I previously attended the presentation last time we did a virtual event during these times of COVID. And this time I wanted to speak about the effects of blue light on the eyes. Most of your children and or college children as well might be doing e-learning remotely on iPads or Chromebooks or their computers. And just wanted, as an eye doctor, my office is in Long Grove, and I wanted to talk about the dangers of blue light and, more importantly, what children are presenting with eye strain these days and things like that. Just to give an example, my two children, ages 16 and 13, after the first week of e-learning, they were begging me for them to come to the office and check their eyes because they were having a lot of eye strain, frontal headaches, their eyes being fatigued, kind of having headaches on the side of their head as well. And so I brought them into the office, and as far as blue light's concerned, there's been plenty of information online. Some parents have been going on Amazon, getting blue light glasses. There's a lot of different confusion and things like that. But really, from an eye care provider's perspective, blue light just really affects the ability to cause excitement in the retina cells in the back of the eye. As adults, our lens inside our eye is naturally yellow and ages over time and naturally filters out some of that blue light. But in children, it's more like a clear window. And so more of that blue light enters the retina. And the only thing from an eye care provider's standpoint that's been proven so far is that it really kind of throws off children's melatonin levels, especially if the kids are having exposure to a device, whether it's a Chromebook or an iPad or a phone, within like 90 minutes of bedtime. Because what happens is that blue light stimulates the retina cells, which then sends a signal to the eye, which into your body, to throw off your melatonin. So research is showing that children of all ages aren't nearly as restful as they once were because they're not getting into that deeper REM sleep in their sleep cycles. But from my perspective, what's even more important than the blue light actually has to do with the focusing strain. There's two systems that come into play when we look up close. One, our eyes turn in, and two, we focus. So accommodation, that's the part of the visual system when we turn 40, kind of falls downhill and people start reading like this, or they use reading glasses. And the second issue is people's eyes turn in. About 20% of people can't converge their eyes like that. And if that's the case, we can do vision therapy or exercise to fix that. But under this extreme e-learning or remote learning for these children, looking at the screens for hours on end, their eye muscles are having to focus so hard. And what it's creating is a myopia epidemic globally across the whole world. In fact, by 2040, about half the world's population will be nearsighted, meaning that they can see well up close, but just not far away. And what happens is physically to the eye lengthens, right? So as the eye gets longer, then kids need a stronger prescription in their glasses or contacts to see better far away. And most parents don't really understand the real ramifications of this. Well, it's more than just giving stronger glasses or stronger contacts. It really has to do with the eye health. And as a parent of two children myself, we want to take care of our children's eye health and general health as best as we can. So globally in the world, in fact, 90% of Asian countries' adolescents are already nearsighted. So lots of the research globally is focused on the Asian area of the countries of the world. And what they're doing in children is they're doing different eye drops to slow down the nearsightedness. If they're very young, we're giving kids bifocal glasses to eliminate that extra eye focusing strain up close. So when they look far away, their vision won't be as blurry. And a lot of stuff that we do in our practice, we've been doing it since 2003, is orthokeratology or corneal refractive therapy, where you wear a hard contact lens at night and it corrects your vision while you sleep, which slows down the eyes from changing. So for children of all ages, these last 3 months at our office have been very busy, and we've been giving kids, even if they see 20/20 vision, we're giving them, including my own two children, a little bit of magnification in their glasses with a blue light filter as well, and they'll wear it anytime they're e-learning. We're getting huge, wonderful responses from parents saying their kids feel their eyes aren't complaining as much. They're able to sit longer. And my own children, it's funny, my kids don't even really like wearing glasses, of course, funny enough. And I get home from work and they still have their glasses on at the end of the day because they feel their eyes being focused much better and not having that eye strain. So it's not so much the blue light, it's if with that little bit of magnification to eliminate the extra focusing strain. And as we all know in our world these days, it's not going away. Whether remote learning, once we go back from COVID, they're still going to be going home with their iPads or Chromebooks in order to do their homework and things like that. So it's important, and what we do is we measure the children's eyes exactly for the glasses. And the good thing that I tell parents is that you don't have to change these glasses for several years, assuming that children have perfect 20/20 vision, their eyes don't deteriorate far away. But it's a certain magnification we give for kids, and it's really great. And in our office, the months of August, September, and October, we partnered with our laboratory, and we got great IZOD and OP frames for kids, and there's a huge selection. And frame and lenses complete is $135, and they're great. There's a 1-year warranty on the lenses, and it's really great. It's less expensive than even Warby Parker, where a lot of people get their eyeglasses online. And so it has a blue light filter. It's doctor approved. You don't really need an appointment to come in. You need an appointment because we're following precautions. So you need an appointment in our optical area, and the staff can take measurements and get you pick out the eyewear the kids love. And it works really, really well for everybody. Or if you have vision insurance, we can use your vision insurance as well. But that's basically the ins and outs of blue light, the eye focusing strain, and doing everything I can as a progressive eye care provider to slow down this nearsighted progression. So thank you very much. Our website is foresightvisioncare.com. If you have any other questions, there's tons of information regarding eye strain, vision therapy, blue light, myopia management, or the corneal refractive therapy. And pretty much that's everything. So thank you so much. I'm happy to be part of sponsoring this group, and I've got wonderful patients in the group, and I'm very happy, and it's a wonderful organization. Thank you so much. Have a great day.